A new report has revealed people living in the far west of New South Wales are twice as likely to suffer a potentially avoidable death as a person living in Sydney. Joining me live is Kate McBride, author and former farmer. Thank you so much for joining us this morning, Kate. These are some alarming statistics. Absolute pleasure. Can you talk us through some of the findings?
Yeah, so this report had started, it was actually originally going to be an op-ed because of course I'm from the Far West, and so this topic is something that's really close to my heart. And we started looking at life expectancy between people in the far west of New South Wales and Sydney, and what we found was quite alarming. There's actually a 5.7-year difference. So people in Far West are dying almost 6 years younger than their city cousins. And then what we sort of thought is this is quite alarming stuff, and often we talk about other rates out that way, but we sort of thought, let's expand it and let's look at why they're dying and what they're dying from. And so we pulled together the causes of death, and 8 out of the top 10 are actually the same. So then we went into life expectancy. After life expectancy, we went into suicide rates as well. And now a lot of your viewers will know that suicide rates in regional Australia are worse than in the cities. But what we found when we actually looked at the rates in the far west of New South Wales compared to Sydney is that while the suicide rates are pretty steady in Sydney areas, within the far west, it's actually increasing. So not only are people in the far west twice as likely to commit suicide, that rate's getting worse.
And I'm really sorry to hear that. Do we know the main reasons why?
So we looked at two other indicators as well, and so that's potentially avoidable deaths, and we found that people in the far west are 2.5 times more likely to die from what's considered a potentially avoidable death. The other thing we looked at is premature deaths as well. So that's anyone dying below the age of 75, and they're twice as likely to die before the age of 75 compared to someone in Sydney. Now, both of these are indicators or key indicators of the effectiveness of a healthcare system. And so that really paints a bit of a sad picture that some of this does come down to our healthcare out there, and we do know the distances that people have to travel, but it's pretty alarming stuff. And so what we've called for is significant investment across the continuum of care, all the way from that prevention side of things to rehabilitation and ongoing care, because there's obviously significant problems going on out there, and the way it's being managed at the moment obviously isn't doing the trick.
Because I believe there was a parliamentary inquiry into the health and hospital services across regional and remote New South Wales. So are you satisfied with the developments? I know what you've just mentioned there, but are you satisfied with any further developments into the outcome of the inquiry?
We think that a lot more needs to be done, and that New South Wales Parliamentary Inquiry did make 44 recommendations, and we've urged that they be acted on as a matter of urgency. The other thing that we looked at was Western New South Wales Primary Health Network, who's done a lot of work out in this space, working with communities and consulting them. And what it comes down to a lot of the time is working with community in this co-design way of doing things, because the solutions in Sydney aren't going to be the same ones in the far west of New South Wales. We have different challenges and we have different levels of access to care. So we really need to be working with community in this space, and that's, making sure that we're also addressing the mental health issues, and things like drug and alcohol rehabilitation facilities was another key thing that came out of this community consultation.
Well, thank you so much for your time and alerting us to these alarming statistics, and we wish you all the best and look forward to hearing more. Kate McBride, see you soon.
Thank you so much for having me on.